Start. Okay.
Sounds good.
Sounds good.
You doing
Sounds
you
good.
Emma, really? Because I thought that you were going to do it. I was ready for you to do it. I was ready for you to do it.
Okay.
I know
I just
that.
know that this was your home.
We do. That part is true. That's, yeah. All right, what I'm going to do is I'm going to share my screen because I guess we're just going to start like that. My hope was to be able to, my hope was to be able to show the people on the monitors, but they're just going to have to trust me now. That's what's going to happen.
So are we live now?
Uh,
Yeah, I think we're live now.
Okay.
Remember, Minister Harris, I'm very, very late, and so I apologize. Um, and I do want to take this time to thank you all for coming. My name is Lori Smalls. I don't know if you've ever met me before. This might be my first time here. Yeah, so I'm the Alliance of Rhode Island. I'm the treasurer, and yes, turn around. And this is Pastor Karen Bird, and we're very, very happy to Reverend Leonard for allowing us to be a beautiful church. Thank you. I mean, we are committed to several things. Our tagline is um, uh, educate, advocate, elevate. Our uh, as the Ministers Alliance, we're a group of leaders in Rhode Island, Southeastern Massachusetts, committed to elevating the voice of Black and Brown community throughout Rhode Island and the vicinity at many levels. One of our primary efforts is our Martin Luther King Scholarship that we award annually. I just want to give a real big plug. Um, Scholarship that happens every Martin Luther King Day. Rose on Kentucky. This year we $5,000 scholarships. Next year, we're going to try to give away $10,000 scholarships. And so if you know people who are in college, uh, please let us know because we absolutely, that's that educate you. So we're very committed to that, very committed to the work that we're doing. We're very proud of the work. And then our second initiative that we just undertook this year is called our Health and Healing Initiative. That's why you're here tonight. Um, this is an initiative by our organization to really commit to getting Black and Brown people um, not to be afraid of cancer. Often in our churches, we don't even say the word like it's supposed to be said. But we are intentional about making sure that we are aware of there's four treatable cancers: lung cancer, colorectal cancer, and prostate cancer. And the initial diagnosis of cancer does not have to be a death sentence. We as people of faith can be committed to have this conversation. Believe that we can help save lives. Cancer is the second leading cause of death among Black and brown people in Rhode Island right after heart disease. So when we're talking about thousands of people being diagnosed, we need to make sure that our people know that there's help available. We want to be committed to lifting the voices of survivors, that are people who survive cancer or their loved ones. So, Ms. Twain, and we've been going in Massachusetts having these conversations with communities to be able to say, at least if we say it, if we are able to talk about it, to get the answers, to have our questions answered, to uh, some of the things of uh, uh, the Bible is. Um, and we cannot scream again. We, I believe that God has elevated the ability of many uh, professionals. And we would ask God to direct us to the people who could give us answers. Right? And so the first step is training, so that really connected to the primary care provider. It includes your family. Look at, I have this whole tool in my hand. Mariana Department of Health has this wonderful tool, family history tool, and this this is a wonderful um, memorial to share with your friends, family, family about your, not with cancer, but with other diseases, of color, all provide that information to our children and our grandchildren and our grandchildren's children. We can show that if somebody in your family, your mother's line, your father's line, has been diagnosed with cancer, you're more than likely to be diagnosed with cancer. But just because you're diagnosed with it does not mean that you have to die from it. If you don't, the doctor, one of the things the doctor asks you, tell me something about your family history. Oftentimes we don't know. We don't know. We found out by doing this that on my grandfather, which are the Carters, which are the Carters, runs right. My brother, right? He has heart disease. My sister. We had known this earlier, we could be able to help. Now, how can we be able to apply this to my children and their children and their children's children? So we are asking people, this is a wonderful discussion to have at any family event. But look, how long did grandma live? How long did grandpa live? You know how they died? They died of natural causes. Had a touch of the sugar. We used to call diabetes sugar. But I think we need to put that down there. We talk about high blood pressure, but we also need to talk about cancer. Uh, in my family, my grandfather died from lung cancer. My sister died from lung cancer. My brother died from lung cancer. My grandmother wasn't a smoker, but because my grandfather was a smoker, she had lung cancer. My mother was a smoker, but she had ovarian cancer. And by the time they caught it, it was already stage 4. And so knowing this information, being able to pass it on to generations, we believe it's going to be a tool to help with that. As we said, this screening, the first part of getting oftentimes that is knowing some things like no symptoms. You have symptoms. You don't what you feel like you had issue, your doctor, the doctor, your practitioner. So we're really not only emphasizing screening through lives, also emphasizing being able to have conversation with your practitioner, family, um, cancer, um, start with. Um, Small story, when my mother was diagnosed with cancer, I spent well, I was on the phone. It can be startling. And so we're also recommending that cases like that, you take a family member with you because they can often hear what you can't hear. Unless you're somebody like me, who's not very helpful at all when you're on the family on the floor. We're not only emphasizing that, but we're also lifting the voices of people who've been diagnosed with cancer. Survive. So, because the point is that diagnosis of cancer does not have to be. Oftentimes, when we hear it, we're paralyzed and we don't move. And so we're talking about that. We're also going to be planning to have a men's only conversation about prostate cancer. Come on, y'all, prostate cancer. Because oftentimes our brothers like to talk about that. You know, that's the Glenn's here. Well, they don't always like to talk about it. and, and that's important to be able to say to your sons and your grandsons, starts for people who don't are not at risk for cancer starts at 55. If in our family there's cancer, you have to go at 40. So it's really important to have these conversations. And that's why we're here tonight. We're here tonight to talk about for people of faith, that we have faith, we trust in the Lord, we believe in the Lord, we believe that He's our know that God has elevated doctors and science so that we can survive. I have been saying that I go to that don't go until we see something wrong. Just talk about it for real. Pray about it. Prayer changes things when doctors work. By the time we go to the doctor, then what we're finding out is level stage 4. Stage 4 means that the cells that started out as cancerous have now spread to the body organs. It makes it more difficult to heal. Not that you cannot be healed from it, but it's more intrusive. So I'm just here as a vessel to speak about the need and screening stage. I think are the first step to healing. We don't want our people to be afraid of that word cancer. And there are 4 screenable cancers: lung cancer, breast cancer, cervical cancer, prostate cancer is more of a blood test. But if we could encourage you to make sure that you speak to the doctor. I'm going to ask Pastor Pam to stand and give her testimony. Her I had breast cancer. Um, I'm going to give you a church member. And I just came off a 40-day fast. I was like, oh, to you of 2010. I to January 1st. They came. I was shocked. I had to tell my family, my children, and God to forgive me. I was so much. Upset. Um, so they called me Wednesday. And I'm like, dude, so this for yourself. Every out. I did, I did have to go to, I did have to, I have one me. Um, that to be myself. And if it was not that, I agree every day said 10 and a few steps had Patsy. And I it happened to well, I went past and all the past talked about it. But so like my father's family say about 80% of the people. Wow. No, brothers, is very, very important. They talk it's hard to talk about how. So this is what the most this when I'm saying But we have it for that we will, but I just want to be we wait till it's stage four. Next, I'll kill for it. Evidently, I'm not loud enough, and I don't believe that to be true. But okay, we gonna find out today.
All right, so not only
Uh, we are letting you know that this initiative is done in partnership with the Bermuda Foundation. If you like, um, uh, they're been very helpful. We just provide us uh, video, every two that provide how all the things that may concern you because that is times that's color are not taken seriously by our doctors. And so we go say, I'm telling you, I don't feel well, or I feel something right, or rectal cancer, if the way that you're going to the bathroom has changed, if you're constipated, if there's blood in your stool, please do not think that that's natural. It's not natural usually. That's an indication that there is a problem. And so, and we advocated for screening two ways. Amen. Uh, again, I'm saying, feeling like you process of colonoscopy, it may
we know that he's one of our providers, that, what the way to the boy done him, but not. Is it? So if we're smoking, we should stop smoking. Because that's one of the big right, and I know that, okay, okay. So with young people, they, they think that the cigarette alternative is not as deadly, although they don't have as much data on that. Again, you're putting something in your body that is supposed to be there. And so again, we're advocating that we have Black people, folks with cancer, because we can make sure that we're there. We're calling cancer, where we did process these. Right? We like a little stuff every now and then. Well, all that processed meat is not good for our body. I'm sorry, we have. We don't know. Again, we have to be able to say this to our families, say this to our family choices on what we put in our food impact that happens to our life. So we're talking about that. We're talking about cervical. So we ovarian cancer. That means that we have to regularly go to our doctor. We have not seen our doctor in 2 or 3 years. We have all this more. There could be a dramatic difference in 1 year. Screening saves lives. Screening are the first step to be healthy. And if you think, well, I can't afford it because I don't have medical coverage or it's going to be too expensive. We are partnered with healthcare that provides those foods, provides connections. We are also looking to hire community health workers who will help navigate through getting primary care physicians, getting signed up for insurance. Please do not let that be a reason why you don't get screened. Please do not let that be a reason why you don't get screened. In Nevada, there are many free opportunities for mammograms. It's just so important. And when you talk about feeling pain in your, it's not supposed to be that way. Please call your doctor. It can be treated and it can be cured. That is very, very vitally important. We need to make sure that we can hit anything on this in this time, and screening saves lives. Screening save lives. And I also want you to know that, and I feel this in my spirit, that because someone contracts cancer, it's not necessarily a condemnation for God. There's but that's why screenings make a big difference. My sister died, maybe you don't know this about her, but she died from cancer. My sister died was feeling pain, and she diagnosed herself with having hepatitis. She died. She diagnosed herself with having hepatitis. By the time that they had detected that it was cancer in her kidney was already stage, and there was nothing more that they could do. And her doctor let us know that cancer is easy because you can treat it. But because she waited so long, she just on the limb and thought it was arthritis for sinus, ended up dying from that. So I just want to say to all of us, know your body, talk to your doctor, know your family,
somebody in your family has had cancer, doctor, please talk about cysts, things screen, and next week we go to another doctor. Because if we don't do this, we better walk and watch our white collar. That is not true. That is not true. So don't to speak of great that it is spiritually. Once we can conquer it, we can take answer to what doctor answer. And to do screen church. Let us to process. The is really virus because it, I think this person right here.
You got that huge challenge, I guess, coming through. But I can't, yeah, I just want to let you know, I didn't have a lump. I didn't have on my breast. I, one in my account had phlegm. I said to my husband, "You slapped me on my chest. Oh, I slapped you on your chest." So I let about 4 or 5 days go by, and I said, "No, don't breathe through your breast. Don't breathe at all." So I went to the doctor. He said, "Oh, did a cyst burst in my breast and it's coming through?" He said, "That's a possibility." She said, "But we had you checked." Sent me to the breast cancer center in Providence, across from the Rhode Island Hospital. And then I was diagnosed. Now they got you on, I'm gonna be very descriptive here. They lay you on the table with two and your nose off. I, I said, "Please, I'm totally, they were doing a test on me." And they decided that, not decided, they discovered that I did have breast cancer. Stage 0 to 1, but it was breast cancer. And I had to have some, some lymph nodes on the arm removed relate to that. And I didn't have to have chemo. I had radiation, which was not that what wasn't hard to go through. But I'm just so glad that I didn't know. I'll say to myself, that's just a cyst. Because my family has a lot of cysts. My brother's had them on his arm, my mother had them on the face, and my father had them on his head. Cysts running our family big time. So I'm thinking, oh, it's probably just, but then I said, nah, I don't want to take a chance. So I'm just grateful. I testified up there in the choir. I said, I just want to say, Lord, I'm not even going to claim this. I'm not going to claim it. And I kept the faith. And I just kept moving, kept going with, but I did find out that one of my cousins in Fall River, my father's first, my second cousin, Joyce, did have breast cancer. And I knew that when I heard about this, I said, yeah, I know that. And then when the doctors ask you, and Lori's right, if you don't know the answer, they may ask you, now, I don't know what my grandmother came, what she died from. My grandmother, Helen, or she had complications with diabetes. But you don't know all these answers on your mom's side, and on your father's side also. I'm glad they have that test. They can go through that information you put on that sheet, which is really, really, really great. And you're right. Tell the youngsters because your mantra is strong. And I want to say one thing about a funeral I had gone to, Sugar Bear, aka David Green's. He had died. He got up on the phone. He said, "I told you guys right now, don't think you're macho. That it takes a couple of minutes." And I thought he said it. It's so true. He said, "Just go get yourself checked." That doesn't make other people. And when he said, I think it probably did. But I thanked him after for saying that because he was great because he was sick. Most people don't say it, but everybody said it. So, thank you.
Well, it should have been, all right. Thank you so much, Ms. Pauline. And so we would, if you have any questions for us, we certainly give you the opportunity to have any questions or concerns, anything about this, because again, as the businesses around, we really want you to know that we want y'all to live, we would think.
Right. That's right. I mean, on our Facebook. Because it's pretty. It's about how big it is. A state is so uh, so the cancer and to Japan's point, maybe you should have a advocate that tell you. Because oftentimes you hear it and you stop listening because immediately we think that, right? And so he said he'd let us know that oftentimes it's because the color have ignored the time and trying to catch him pretty in this. Again, we want to go back with a second.
You're gonna call him Toby. Yes, she's a driver.
Yes.
Hi, Pastor Lori. Hi, I am here, but if you can you go by me and come back to me? I got called into another thing really quick that I have to take care of.
You'll probably be gone by the time you come back. Thank you, anyway.
Oh no, I'm here. I'm still here. I'm not leaving. I just need to take care of something that's in front of me right this second.
Yes. Are you still here?
Yes, she's Anita's there.
I'm looking at the phone screen. You can't see them.
Okay, they're up here. You can ask Anita.
Anita is from United Healthcare, and she's one of our partners. She has been very instrumental in making sure that if people need access to healthcare, again, if that's something that is preventing you from getting screened, don't let that be a reason. There's many resources available, and we can help you navigate through that. Um, if you're afraid to go to the doctor and you don't feel like you can take your family, if you would reach out to any of us at the Ministers Alliance, we'll be happy to connect you with a community health worker who can help you go so that you can talk to your doctor. And that's vitally important. We are the experts. Physicians are. And again, if you're having difficulty navigating the whole medical system, and you think, what about insurance or anything like that? We do have a program at our hospital also helping through that. We'll be happy to connect you. They've given us their direct line, so you don't have to do the switchboard. You can call them directly. And so if you need that information, we can give that to you. We can get you
Hi.
connected with other resources in the community. You ready, Tony?
I am. I'm
Uh,
back. I'm so sorry about that.
that's all right. We're gonna hear you.
Right,
We
you're
won't
gonna
see.
hear me. Right. Because
All
it's
right.
working better for me if you just hear me. I'm so sorry. Like when I turn my camera on, it gets like really, and it could be the building that I'm in.
All right. All right. Come on, Toby.
All right. Hi, everyone. So back in 2014, my father was diagnosed with stage 4 prostate cancer. He went to see my little cousin graduate from the an army graduation when she became an officer. And on the way, he got sick, and my aunt convinced him to go to the hospital. We convinced him to go to the hospital. The doctor gives us this diagnosis once they step into the room. And so frantically, everyone's calling me on the phone trying to get me, and they get me on the phone and they give me this diagnosis, and I'm like, wow, dad, like, wow. I walked with my dad through this whole entire process. It was our faith that kept us. It's very important for people to get screenings. I advocate for screenings. I advocate for all of that because I watched this disease wreak havoc on my father, who was a musician, who was a singer. It enabled him to be able to do what he loved to do. I mean, there were days where he was in so much pain where he would just ask us to take him to the organ because, he just felt like if I could just do something, I could keep my body active and it was going to just prolong the inevitable. Our faith is what kept us strong. And I allowed my father throughout the entire process to um, manage his symptoms, manage his treatment. What I can say about our community, when we hear the word cancer, when we get the diagnosis cancer, everyone becomes frantic, and everyone feels like they become an island. And then we have all these things where people want to become overly protective of the person because nobody wants to let the person go, and everybody wants to feel like they're responsible for keeping them here. What I will say to that is if everybody would join the forces and just get the screenings, do the preventative things, and do the things that's necessary to help fight or help prevent these diseases from striking our families. Education is important. Get all you need to know. If you have cancer that runs in your family, if you're a male and prostate cancer has taken one of the patriarchs out of your family and it's a male, encourage the males in your family to get screened. Encourage them. I have sons. I don't have any daughters. So I talked to I lost my oldest in 2020 due to a car accident, but my youngest, he's 24. I talked to him about prostate cancer. Get that screening. I know you may not like it, but get the screening. Talk to the doctor about it. Tell them that your grandfather died from. What kept us going, what kept us pushing, what kept me pushing is that I relied on my faith. We tried all avenues. We promoted healthy eating. We promoted healthy everything for my dad. We encouraged him to do what was right, but ultimately, we did lose him. But when we lost him, it I was okay with it, even though I wasn't really okay, but I was okay because I knew we did everything that we could possibly do for it. And unfortunately, because my dad was one of those men that didn't want to go to the doctor, that didn't really like the doctor, this is where we landed. He went in for what he thought was something simple. And when we came home with the diagnosis of there's nothing really that we can do. And it forced us to our faith. Our faith gave us 4 more years where he was able to be strong, vibrant. He passed away on his own terms, at his own digression. I had just left him. And within a week, I had been, because my aunt helped take care of him. So I was back and forth to Virginia. I had just left him. And I wasn't home a good week. And my father just one day, my aunt, the nurses called her and said, I think you need to get to your brother's house because something's happening. And when she got there, my father was already transitioning, and that's how he wanted to go. He didn't want any of us bedside because he didn't want any of us to have to see that process. But I encourage everyone to just, if you can take nothing else away from what I said, please Tell the men in your family, get the blood test, get the screenings. That is all that is needed.
Thank you, Toby. He made a statement that I think is very important. Um, Oftentimes, we in the church don't want to say that we're sick because we don't want people to feel sorry for us. That's when we need really, on the diagnosis, that's when we really need to gather around each other as family to pray for one another. So as we close, we want to say thank you. We want to remind you to take this at your next family gathering, fill it out, fill it out, share it. Benita, do you have something to say to us? She's at an event. Oh. um, Fill it out, share it with your family, uh, pass it on, use it as a part of your family history too. Just as much as you know who your grandfather, great grandfather, great great grandfather, big mama, as you call her, you know that. And this is not just for cancer. It's for diabetes, hypertension, cholesterol, all the things that take us out. Right? Please fill that out, share it with your family, use it as a part of the history. Get screened. If you have any questions, you can contact me, you can contact Pastor Pam, you can contact any member of the Ministers Alliance. When we have our screening partners, we would love to come back to take you through the next step and then come back and also talk about survivorship because it's vitally important that we understand, as Sister Toby says, as Pastor Pam, as Miss Pauline, that cancer doesn't have to be fatal. Right? We can catch it early. There's so much data says that it can be, it can be cured. There are some cancers that have no symptoms. You just need to know that. But that's why you need to go to your doctor and know your family history. If there's cancer in your family, you should tell them there was cancer. Somebody in my family died of cancer, and I want a blood test. Thank you very much.
Thank you.
Thank you all for joining us. Appreciate you guys. All right. That's it. That's all I got.
Remember the friend on.
Oh, hi, Miss Loretta.
Okay. If it's something that needs like some added.
Okay.